Hi, I'm Dr. Karaaltin from Karaaltin Clinic in Istanbul. Today I want to talk about a special featured technique that we're doing in our clinic. It's called the signal interrupting nerve transfer. It's a very unique technique that I've invented, and it addresses patients who are suffering what is called the synkinesis. Synkinesis is a big troublesome problem that can happen in facial paralytic patients. It's actually a missignaling of the animation of the muscles in the face. As an example, when the patient starts to smile, they blink their eyes involuntarily, or the opposite, vice versa. So we have misleading in the signaling pathway of the healed facial nerve that leads to this problem. In order to overcome this problem, there are a lot of methods like selective neurolysis, chemoneurolysis, but we've just introduced a new technique that helps a lot, especially with the lower half part of the face. It's called the signal interrupting dual nerve transfer. What we do here, we try to select the aberrant branch, the problematic branch that has a misleading signal. And when we identify that, we identify it with a special device called a neurostimulator. And afterwards, we pick up a branch on the unaffected side, and then we transfer a nerve that we've taken from the leg, a substitute nerve, and then we swap it up over through the tunnel, bring it to the affected branch, we cut the branch, and then we connect it with the unaffected branch from the other side. As you know, that we can steal a couple of branches from the unaffected side without giving problem to the affected side. By doing this, we're interrupting the signal that was creating the misleading signal on the affected side in a synkinetic patient. Moreover, we add another functional nerve transfer, especially if the lower branches are weak and are not able to move out the lower part of the lip. The nerve that is responsible for moving the lower part of the lip is called the mandibular marginal branch. We identify the major trunk of this nerve, and then we use the nerve stimulator to identify the problematic nerve, which is weak, and then we identify the nerve that goes to the masseteric muscle. It's the chewing nerve responsible of acting and functioning the chewing muscle at this position. We cut it out, and then we connect it to the affected trunk on the lower part, where we call the lower mandibular branch. And that will give some signaling power in order to initiate a motor power in the lower part of the lip that will restore the signaling process in an overall fashion. So by doing that, we're interrupting the signal, and we're adding extra motor signaling in order to create and correct the synkinetic problem. Thank you very much.